process is underway to get feedback from South Africans in the crafting of new regulations to manage the COVID-19 pandemic in the country. The proposed changes were published by the Health Department amid lobbying for the country to open up more due to the low infection and death rates. The current rules are based on the state of disaster declaration, which was enacted back in 2020. That's when there was limited knowledge about COVID-19 and no vaccines. Now, in the latest 24 to 48-hour reporting cycle, the country recorded 1,287 new infections and 3 new COVID-related deaths. Dr. Nicholas Crisp from the National Health Department joins us now to talk more about this, shall we say, participation process for you, the public, as far as where to go next as far as regulations. Dr. Crisp, always good to have you on the program. Where are we as far as submissions and feedback from South Africans since you started this process?
Hi, good evening to Mikile and to the viewers. So I think maybe it's a good idea just to explain to people what regulations are and how they work. The whole country is governed by laws that are enacted in Parliament, and we call those acts. And we in the health sector are primarily governed by the National Health Act. There's always a section in an act that allows the minister to make regulations. So acts are made by Parliament, and they take a long time, anything from 2 to 5 years. But a regulation is made by the minister. And in the case of the National Health Act, the regulations have to be published for no less than 30 days before they come into effect. So that is what has happened. There are, in fact, 4 sets of regulations. It's quite a sizable document, 156 pages to be exact. And the section that people are referring to is the regulations that relate to the surveillance and control of the notifiable medical conditions. Now, those regulations have been in place for years, since 2003 when the Act came into effect, and they are merely being amended. So what has happened is that the department has published those amendments together with amendments to our involvement in the International Health Regulations Act, as well as the regulations relating to the management of human remains and the regulations relating to environmental health, all at once in one set of regulations. The objective with the changes of all of these regulations is that they will provide for the kinds of things that were allowed under only the Disaster Management Act. So once these regulations are available to us, if we need them, then we don't need the Disaster Management Act to be in place from a health systems perspective anymore.
And there's been criticism that the Health Department has dragged its feet to some extent in getting us here, and that, in fact, we should have done away with the state of disaster declaration months ago, even according to some of the vaccinologists and epidemiologists who've been commenting on the situation. Do you think that's fair criticism?
Well, look, I think they have the privilege of sitting outside of the system where you don't really get to hear the debate that goes on with other government departments, with the state law advisor, with the various senior counsels who are advising on these things. So we would agree with them. We would like to do away with the Disaster Management Act. I think the whole of government has long ago said that we would like to do that. But there are several government departments that have been busy with regulations for a long time now. In fact, we've been busy with these for well over a year already. But the problem is when you try to enact or bring into effect regulations where the Act does not provide for the regulation, then you have a problem on your hands because it takes years to amend the Act. So we've been in a process for some time of consultation and negotiation, I guess, with other government departments, including the state law advisor, to get the wording right so that the regulations that are now published cannot be regarded as contrary to the Constitution in any way. So fair enough to criticize and to be unhappy, but the important thing is that we don't mess it up and that we get it right the first time.
And one of the regulations I was looking for, especially unvaccinated people when it comes to gatherings, which is what people want to do more of in the weeks and months ahead, indoor gatherings for the unvaccinated capped at 1,000, 2,000 outdoors. What is the science behind that?
So there are a number of places where the regulations are potentially, so what these regulations have proposed is 50% of a gathering to allow for social distance for people who are unvaccinated to in a space. You don't want a lot of people who are unvaccinated. We don't know if they've been exposed. We don't know if they have any immunity from wild virus. We don't know anything about them if they haven't been vaccinated. And that creates a potential risk to people in that space. So the idea is that you want a cutoff which you can systematically move. And remember, regulations can be changed by the minister from time to time when we see there's no need for them to be in place. And for spaces where everybody is vaccinated, you can allow a lot more people into that space. So the indication, if we were sitting in the position of other countries where 70, 80, 90% of our population were vaccinated, we would have a different view on things. But right now, sitting with just under 50% of the adult population vaccinated, we think there's still significant risk, and that risk needn't all be taken at the same time. We know that there's likely to be a fifth wave coming. We don't know what that wave will look like.
Okay.
We don't know what the mutation will look like, so we want to err on the side of caution.
So what then, Dr. Crisp, is the point, I wonder, of further restrictions when, and I want to get your take on this, some experts in the field have said that even though only less than 50% of South Africans are fully vaccinated at this point, most people have already had COVID anyway, so they do have some degree of protection.
Well, I don't think that they said most people. I've said that they have said many people have, and certainly the figure is quite high. But the same specialists and others have said that the immunity that is conferred from a wild virus infection is nowhere near as good as the immunity that is conferred from vaccinations. These are vaccinologists we're talking about. They study this stuff just as we do, and we take our advice from a wide range of people. So even those who are critics would agree with us that it is far better to be vaccinated and for us all to have long-lasting immunity. We don't know how long wild virus immunity lasts for, but we do know that it's not as good as having both a wild virus infection as well as vaccination, and it's even better if you've had a booster. So there's one thing that we do all know, and that is that the more we are vaccinated, the lesser the chance of transmitting and putting people at risk. There are still a large number of people in the population who are getting sick, might not be as many as before. And as I've said, we don't know what is going to happen with the next wave. We could reduce all of the regulations and then impose them all again in a couple of months' time. But we have chosen to go a slightly more cautious route at this stage.
Just on that point then, about what the measure would be that determines when we'd have to go back to a situation perhaps similar to what we saw in 2021 and even 2020. I know there is significant difference so that we now know more about the COVID-19 virus itself as well as vaccines that are available, but under what circumstances could we possibly go back into harder lockdowns and tighter rules?
Yeah, so I think the chances of us going back to, during COVID, even with another variant, to the sort of lockdowns we saw right in the very beginning is highly, highly unlikely. I don't think we are going to get to a position where all our hospitals are jam-packed and all our ICUs are completely blocked. I say that reasonably comfortably because that's the behavior of pandemics over time. But we can still get quite large numbers. We saw it even during Omicron, where the numbers were very large, with lesser number who were severely ill. But it was still a significant number, and we were still seeing people dying every day. And we still had 60% of our high care and intensive care unit beds occupied during that time. So it's the risk to the health sector. Remember, the health sector has been flat out at it now for more than 2 years. People are extremely tired. They have not had good leave for a long time. They've seen things that, their own colleagues and relatives dying and getting really ill. And we don't want to put that kind of pressure on the health sector. So that's one issue. The other issue is we don't want to collapse sectors of the economy. We don't want to have to close schools. We don't want to have to clamp down on transport and movement of people unnecessarily. So when the numbers rise, that's when you do that to be able to contain the spread of the disease.
Okay.
Now, we don't expect that to happen. But we've learned the hard way with COVID that anything is possible. And if we get the type of variant that we're expecting, we should be fine.
Okay.
But the same specialists who have criticized us were the ones who criticized me when I said at the time of the second wave that we hoped that it would be a milder infection after the first one. And they weren't happy that I said, provided that there's not another variant. That's the fact. The fact, if you get an aggressive variant, is you're in trouble. So I think we just, as I'm saying, we're playing a little bit cautious at the moment. We're not trying to strangle the economy in any way, and we'd like people to be safe.
And very briefly, please, Doctor, if you can, there's been intense lobbying over the past few months, weeks, for a full return to stadiums for sports fans, soccer, and the other sport as well. What is the likelihood that South Africa will ever see stadiums that are packed to full capacity?
Well, as soon as South Africans vaccinate, they can all go back to sport without worrying. We've been saying it right from the beginning. So we are encouraging sports authorities and others who run large events, including the religious community and others, to require vaccination. Then we know, we're not guessing that maybe a portion of this particular community is or isn't vaccinated. Once we know that everybody has been vaccinated, fully vaccinated, and has significant immunity, then people can go back in their numbers because the risks decrease dramatically. So we've said this before in the health sector. The future is in our hands as citizens. It's not in the government or one or two officials or the minister's hands. It's in all of our hands. And we know people are reticent to vaccinate. We're still not quite sure why. They would prefer to believe people who are spreading stories on the social media instead of all these experts that we have. We have fantastic scientists in this country. Why don't we believe them?
Thank you very much for that, Dr. Nicholas Crisp with the National Health Department.